There's also skin texture and irregularities that we can fix, sometimes with creams, sometimes with peels, sometimes with lasers. And it really depends on each person's individual skin needs. But we really do have fixes for most of these things. Hey guys, it's Dr. Samir Undavia from NJENT and Facial Plastic Surgery. And today I wanted to talk to you about something that I think about a lot for myself. And that is, what are the things that make you look old? So obviously a few different things for guys and girls. And there's the obvious things that I'm not going to touch on, which is gray hair, a really tall forehead for guys, receding hairlines. But what are the things that we can think about systematically for an aging face and an aging neck? And I kind of want to start with generalized features and then work from top down. So the first thing that I notice as we age is that you have volume loss. And it could be volume loss in the cheeks. It could be volume loss in something called the temple right here. It could be volume loss in your lips. But as you age, you lose volume in your fatty tissue, in your muscle, in your skin thickness. And these can all give you a less full face. And, you know, we spend most of our youth trying to have a chiseled face, but afterwards, we really do want a full face. It is youthful. So as you lose volume in these areas, what are the things you can do to treat them? Well, in the temple, you can do fillers. Actually, you can do fillers in multiple areas of the face. You can do fat injections. It kind of just depends on what the area is, the amount of volume loss, and what your goals are. So that's one of the main things that we see is volume loss in these certain areas. The second thing we see is we look at the eyes, and it's about either it's basically your eyes don't look as bright as they used to. So that can be because of the eyebrow, it can be because of the eyelid margin, it can be because of the eyelid skin. But in general, we see the eyebrows coming down. And for, women, we want to see more of an arced eyebrow closer to the side. Men can have more of a straighter brow, but still needs to be a little bit higher. Sometimes we see extra skin, as I'm starting to get right here. But your eyes don't look as bright. So the things that we can do to make your eyes brighter are, one, you can use Botox. Botox can help lift up your eyebrow and give you more space right here, and it can make your eyes look more brighter or open. Kind of makes you look like you just had a nice night's rest. You can also do Botox here, and it can raise your eyebrow in both areas. You can do something called a blepharoplasty. Blepharoplasty gets rid of some of the skin in the upper eyelid. For the lower eyelid, it could either be that you have a trough, so there's like a deep line right here. It makes you look like you're tired. Or you can have puffiness from the fat coming forward. So we can treat both of those things to make your lower eyelid complex look more youthful. For the eyebrow itself, I really do love Botox because it's forgiving. It looks so natural and it does raise your eyebrow. But if that's not enough, we can do a brow lift. And there's many different types of brow lifts that you can do. It really depends on your anatomy, your forehead, whether you're a man or a woman, and what the goals are for surgery. So that's brow lift for the eye complex. Now, something that's gained a lot of popularity, but I love, is the upper lip or a lip lift. So as we age, our upper lip becomes longer and longer. It really does make you look older than you are. So shortening the upper lift, you can do it temporarily with a lip lift, and it's really a very modest or small outcome, but it can be a nice bridging procedure where you put some Botox right here, and it helps relax the muscles and show more of the red part of your lip. And if you show more of the red part of your lip, it just naturally makes the skin part of your lip look in proportion less tall. So you're just trying to kind of use some tricks to make your upper lip not look as long. But if that's not enough, what we can do is a lip lift, and we do something called a perialar lip lift, and we go underneath the nose here and we shorten the lip. And everybody's a little bit different, but in general, it's between 4 to 6 millimeters that we're trying to shorten the upper lip. And It looks amazing, and it really does wonders for making you look younger. The thing that probably most patients recognize as the reason they feel or look older is jowls. So how tight your jawline is, and wrinkles. So jowls are, as we age, our skin continues to grow, but we lose some of the tensile support and elasticity of our skin to be in the upward position. So as our skin comes forward this way, it's going to get hung up on some ligaments right here, and then you get a little pouch right here. It makes you look older. So if you wanted to treat your jowls, you can sometimes try and camouflage them by putting filler in front and behind so it doesn't look like it's a pouch, or you tighten it with a face and neck lift. And there's many small different variations and versions of that, and they're patient specific. But in general, you're trying to resuspend some of these support structures of the face in a more youthful and superior position. Wrinkles, on the other hand, can respond to Botox. So forehead, just like I have a bunch of little wrinkles right here, you have to be a little bit careful because another problem that we have is our eyebrows coming down. But if you treat the forehead with Botox, you have the potential for more of your eyebrows to come down as opposed to stay up. So the forehead is one of the things, forehead muscles are one of the things that are keeping your eyebrows in the elevated position. So if you mute some of their or paralyze some of their motion, you're going to get your eyebrows to come down. So you got to do this in a careful manner. But getting rid of some of the forehead wrinkles here, some of the nasolabial fold wrinkles here can be very helpful in not looking as old as you feel. So those are the main things that we address. We really do have fixes for almost everything. There's also skin texture and irregularities that we can fix, sometimes with creams, sometimes with peels, sometimes with lasers. And it really depends on each person's individual skin needs. But we really do have fixes for most of these things. So I hope that helps. If you have any questions, email us at info@njent.com or visit us online and on our social media.